Want to pass your Med Surg HESI and your ATI exam? Then let's get started. Today we'll be covering 10 questions on the respiratory system. Question 1. Which of the following is a characteristic sign of ARDS? Hypoxemia, hypercapnia, bradypnea, increased lung compliance. Pause the video and select your answer. If you chose option A, you are correct. Hypoxemia. Hypoxemia is a characteristic sign of ARDS, indicating inadequate oxygenation of blood. Question 2. Which condition is characterized by chronic airflow limitation that is not fully reversible? Asthma, chronic bronchitis, emphysema, pneumonia. Pause the video and select your answer. If you chose option B, you are correct. Chronic bronchitis. Chronic bronchitis is defined by chronic inflammation of the bronchial tubes leading to airflow limitation, which is not fully reversible. Question 3. Which medication is commonly used as a bronchodilator in the treatment of COPD? Albuterol, diphenhydramine, furosemide, prednisone. Pause the video and select your answer. If you chose option A, you are correct. Albuterol. Albuterol is a short-acting bronchodilator commonly used in COPD to relieve bronchoconstriction and improve airflow. Question 4. Which nursing intervention is appropriate for a patient experiencing an asthma attack? Administering oxygen via nasal cannula at 2 liters per minute, encouraging the patient to lie flat in the bed, administering a beta blocker, administering a short-acting bronchodilator. Pause the video and select your answer. If you chose option D, you are correct. Administering a short-acting bronchodilator such as albuterol is a primary intervention to relieve bronchoconstriction during an asthma attack. Question 5. Which finding is characteristic of pneumothorax? Hyperresonance on percussion, increased tactile fremitus, decreased breath sounds, increased diaphragmatic excursion. Pause the video and select your answer. If you chose option A, you are correct. Hyperresonance. Hyperresonance on percussion is characteristic of pneumothorax due to the presence of air in the pleural space. Question 6. Which action should a nurse prioritize for a patient with a tracheostomy tube? Cleaning the inner cannula daily, removing the outer dressing weekly, changing the tracheostomy ties every shift, occluding the tracheostomy tube during mealtime. Pause the video and select your answer. If you chose option A, you are correct. Cleaning the inner cannula daily helps prevent obstruction and infection in patients with a tracheostomy tube. Question 7. Which assessment findings should a nurse expect in a patient with COPD? Increased FEV1, barrel chest, hyperresonance on percussion, bradycardia. Pause the video and select your answer. If you chose option B, you are correct. Barrel chest or an increased anterior-posterior diameter of the chest is commonly seen in patients with COPD due to hyperinflation of their lungs. Question 8. Which condition is characterized by inflammation and narrowing of the airways, leading to symptoms such as wheezing, dyspnea, and cough? Chronic bronchitis, emphysema, asthma, pulmonary fibrosis. Pause the video and select your answer. If you chose option C, you are correct. Asthma is characterized by inflammation and narrowing of the airways, leading to symptoms such as wheezing, dyspnea, and cough. Question 9. Which diagnostic test is commonly used to confirm the diagnosis of pulmonary embolism? Chest X-ray, ABG analysis, D-dimer assay, bronchoscopy. Pause the video and select your answer. If you chose option C, you are correct. The D-dimer assay is a blood test commonly used to screen for the presence of a blood clot formation, including pulmonary embolism. Elevated D-dimer levels can indicate clot formation, although other diagnostic tests are needed to confirm the diagnosis. Question 10. Which complication is associated with prolonged mechanical ventilation? Atelectasis, hyperventilation, pulmonary fibrosis, pleural effusion. Pause the video and select your answer. If you chose option C, you are correct. Atelectasis or collapse of a lung tissue is a common complication of prolonged mechanical ventilation due to reduced lung expansion and alveolar collapse. Click that subscribe button and join us next Monday.